Hello and welcome to Module 6 Portfolio Assignment, the Museum Exhibit. The purpose is to explain and illustrate the history and current complexities of the patient without insurance billing process and its associated data from a patient's visit through completed payment of services. And what you're going to see is that cost is a driving factor for those without healthcare insurance, especially in the 19 to 64 age group population. Now let's take a look at some of the history. In 1930, many people were beginning to understand that healthcare was making great strides and advances, and in particular in terms of vaccinations. Hospitals were considered more safe, so there was a greater demand for services. So how do people pay for this at this point in time without health insurance? They had to get really creative. As a result, the image of a doctor accepting eggs, a pair of boots, or a bushel of potatoes for treatment was very true, and doctors often practiced this kind of sliding scale fee system in which they treated the poor for very little but expected their wealthier patients to pay more and subsidize the community. Now, by 1938, the American Medical Association determined there needed to be a better way of doing this, and they were trying to avoid federalization that they saw coming in the 1930s, so they agreed on a health insurance model. But what does that model look like? The early models were very stingy, meager, and barely covered anything. A policy, for example, might cover 10 specific diseases and nothing else. Problematic as it was a start. Now, eventually, the insurance company model started to seem like the obvious choice for most Americans, but the basic problem is that insurance companies have grown into something that they weren't meant to be. So as we move forward, we take a look at Medicare, which currently is the insurance provider for some 43 million elderly and disabled adults, and many consider it to be the harbinger for the progress of healthcare reform. It's considered a huge success for this population because of the quality medical outcomes as a result. But before Medicare was created in 1965, only about 55% of seniors had health insurance, and many physicians have a love-hate relationship with Medicare, but the reality is it's proven to be their most reliable payer. Now, why don't people have insurance? It's because of the costs. Take a look. In every single instance that people were asked, look at how high the percentage is for people not seeking access to medical care, filling a prescription. It's because of cost. But going without coverage can have serious health consequences for this uninsured population because they receive less preventative care, which often results in more serious illness requiring more expensive advanced treatment. And in the first 3 months of 2017, 28.1 million Americans were still without health insurance. Why is that? Because of the cost. The cost is too high. It's something that was repeated over and over. Now let's take a quick look at the healthcare billing process. Patients get registered. Pretty straightforward. But here's where it gets a little complicated, is that establishing financial responsibility for the visit. If you don't have a policyholder or an insurance company, you are responsible, and you sign off to that effect that you are responsible for all your treatment. Then comes step 3 and 4. When you check out, a medical coder assigns a diagnosis code to all of your primary illnesses. But even more than that, when it gets to the review billing compliance, normally a health insurance company would step in at this point and say, no, that's the wrong code, that's not what we agreed to pay, we will pay this. But as a sole payer without insurance, you may not have the skill set to do that, and so as a result, many end up paying much, much more. And even here, where they prepare and transmit the claim goes directly to the person that doesn't have healthcare insurance instead of to the insurance company. So as a result, you get to these final steps where someone without healthcare insurance doesn't have any adjudication as a result. They receive the statement, and if they don't make those payments, the problem is that if they're delinquent, the biller may look to seek to get payment and may look for, in worst case scenarios, enlist a collection agency and take the patient to court. So you've seen a very quick look at the registration process, but we know that the cost is a driving factor for those without health care insurance, especially in the 19 to 64 age group population. And thank you for listening.